So this is part 3 of things that may happen after a heart attack. As I have said in the previous 2 videos, this is not to scare you because heart attack on its own is quite scary to deal with. But I just want to give you the information because this is something that is important to know. By knowing these things, especially for the symptoms, then you can look for those things. Because after a heart attack, your heart can also develop dangerous rhythm, and some of them can be life-threatening. And this is even when you start feeling better. So we're going to talk today about the ventricular arrhythmias. Ventricular arrhythmias are abnormal heart rhythms that start in the lower chambers of your heart, the 2 ventricles. So sometimes after a heart attack, the damage that has been done on the tissue of the heart, the muscle, can disrupt the normal electrical signal, and this will cause irregular beats. So there are 2 types of ventricular arrhythmias. The first one is the ventricular tachycardia. This is when the beat of it goes very, very quickly. And as I said, it starts at the ventricle. And the second one, it's a ventricular fibrillation. This is more like a chaotic electrical activity that makes the heart quiver instead of pumping blood effectively. So the symptoms can include palpitation, sometimes dizziness, even fainting, chest pain, or it can even go to a sudden collapse. And sometimes there's no symptoms at all, which is why monitoring after a heart attack is very, very important. The risk factors include the size of the heart attack, the scars that has been done on the heart tissue, on the muscles of the heart, sometimes also the heart failure. It could also be because electrolyte imbalances. So your cardiologist may recommend some medication like beta blockers or sometimes even antiarrhythmics. And in some cases, devices like an ICD, which is an implementable defibrillator to prevent sudden death. So lifestyle measures are so important too. So controlling your blood pressure, maintaining your heart healthy habits, avoiding stimulants, and following up regularly with your cardiologist. So the key takeaway, if you've had a heart attack, your heart's rhythm does deserve attention. Ventricular arrhythmias are serious, but can often be managed or prevented with the right care. So always report unusual symptoms and never, never ignore palpitations after a heart attack. So I hope this was helpful, and I know you've got this. Till the next one. Tolu.